My interest in glioblastoma started very early in my residency. When I was internal medicine intern, I took care of a patient with glioblastoma and realized how difficult this disease is and how less things have changed for these patients in so many decades. It still remains a mystery and we don't know how to treat it. Even today in 2025, we don't know how to best treat it. We are treating it with alkylating agents or broad spectrum chemotherapy drugs that have been in use for several decades now. So I think it's a very fascinating field, and a field that really needs to change very, very quickly so that we have better answers for our patients. The other thing that led me to this field is a faith, a belief that the best patients, the best people in this world get glioblastomas. I think the nicest human beings get glioblastomas. And when I see a patient with GBM for the first time, and when they ask me, why did I get it? I don't smoke, I don't drink alcohol, I eat healthy, I exercise, and I tell them that, the only risk factor that I know of is, just being a good human being. And so I think that we really, really need to change this field. We need better research for these patients, and that is the reason why I am a neuro-oncologist and I do what I do. I think some of the biggest unmet needs are patients who are not getting surgeries at bigger cancer centers, so not getting to a brain tumor neurosurgeon in time, and getting surgeries done at smaller places where they don't have the infrastructure or the equipment to do, for example, an awake craniotomy, and therefore not being able to get maximum surgical resection, or just starting treatment right after a brain biopsy, because we know that maximum surgical resection is associated with better outcomes. Access to clinical trials is also an issue. There are patients who get on treatments before getting to a large cancer center, and therefore sometimes are ineligible for clinical trials because they've already started some kind of a treatment. So I think access to clinical trials, access to more information. So all of us know a patient with breast cancer or lung cancer or prostate cancer. So when in families patients get diagnosed with a cancer that there may be more awareness about, or maybe a more common cancer, then they know somebody that has had that cancer and can guide them. But with brain tumors, most of my patients tell me that they don't know anybody with a brain tumor, that they're the first one among their family and friends to have had a brain tumor. So I do think that, especially as we go away from larger cancer centers and larger hospital systems, I think the awareness is extremely low. I think those are the two big unmet needs.